I'd like to thank you all for having us here today. My name is and this is my colleague, Ray Pei. We are co-founders of HemRx Medical, providing one solution for hemorrhoids. Hemorrhoids are a very common problem in the adult population. With a peak incidence between the ages of 45 to 65 years of age, hemorrhoids are a real and underestimated problem for the boomers population. As we will demonstrate, the problem with current treatments is that they're either not effective, painful, or require surgeon-specific skills. Our solution creates a paradigm shift by bringing treatment outside of the operating room, increasing efficacy while minimizing procedural pain, and allows use by both gastroenterologists and surgeons. Our total potential market is approximately $500 million with a large range due to poor epidemiological data. We'll require a total capital investment of $21 million and project profitability in approximately 6 years. A reasonable valuation on exit is between $100 to $160 million based on projected revenue, which will give investors a 4 to 6x return. So what are hemorrhoids? They're a complex network of veins in the anus that can become engorged with blood and cause debilitating symptoms. Now, blood is supplied to the hemorrhoids through superior hemorrhoidal arteries, as shown above. And it's important to note for treatment that tissue located below the sensation line, denoted down here, is very painful or very sensitive, whereas above, there's no sensation to pain. Hemorrhoids pose a significant problem with a market of over 13 million patients and an incidence of 1.5 million new cases every year. As mentioned previously, the peak incidence coincides with the boomer population, placing this market in a period of major growth. The current market for devices in this space is approximately $250 million with a total potential of $750 million. Yet despite this, 2/3 of patients suffer without treatment. Why? Predominantly because of 2 reasons: lack of good treatment options and a very complicated referral pathway. So what are the current treatment options? There are medications and creams such as Preparation H, but they need to be applied 4 times daily and really are still not effective. There's rubber band ligation, which consists of placing a band at the base of the hemorrhoid to eliminate the blood supply to the hemorrhoid. But this has a recurrence rate of 30% and requires multiple visits. Hemorrhoidectomy, which is the surgical removal of hemorrhoids, is the gold standard and very efficacious. However, it's an operation of last resort due to severe complications as well as severe pain. A newer procedure called stapled hemorrhoidopexy was designed to minimize the pain of surgery by stapling out the hemorrhoids. Yet because it still involves cutting, it has been shown to be no less painful than hemorrhoidectomy. So currently there are no treatments that are effective, minimally painful, and allow use by both gastroenterologists and surgeons. HemRx will address all of these needs. This diagram shows the current complex referral and treatment pathway that a patient with hemorrhoids typically experiences. Initially, they see their primary care doctor, but for the 90% of patients who present with bleeding, they must first be referred on to a gastroenterologist. Now, gastroenterologists can treat some mild forms of hemorrhoids, but typically don't because the only technique they have is very cumbersome and difficult to use. General surgeons, on the other hand, have a variety of treatments shown on the bottom depending on the severity of the hemorrhoids that they see. One of the key components of our value proposition is that we will simplify this pathway by enabling both gastroenterologists and surgeons to treat all hemorrhoids with one simple, minimally painful procedure. Targeting gastroenterologists will expand the market as they are the gatekeepers to these patients and currently have no good treatment options available to them.
So the solution that addresses all these unmet needs is this device, the HemRx. Now allow me to explain how HemRx works. Similar to a digital finger rectal exam, such as the index finger, the device is inserted until a safety mechanism is in contact with the external anus. This is to ensure this working end of the device is inserted past the sensation line in the region where there's no sensation of pain. Following which, the device will deploy a Doppler sensor to locate hemorrhoidal arteries, as you can see over here, they're hidden beneath the tissue surface. Under precise radiofrequency energy will be delivered to gently seal the artery. The radiofrequency energy will be stopped automatically once the Doppler sensor detects no blood flow. This is to ensure minimal tissue damage in this region. This will be repeated until all 6 hemorrhoidal arteries are found and sealed. By sealing arteries that feed the engorged hemorrhoids, the hemorrhoid will then recede over several weeks. This procedure can be performed in less than 10 minutes.